Hola, saludos a todos. Hello, everybody.
Hello, everybody.
Yeah, we're here one more time. We're going to talk about important topics because, as you guys know, we recently opened a med spa, Aurea Med Spa.
Yeah.
The Aurea Med Spa. And we have a lot of questions regarding Botox, fillers, and all those kind of procedures for rejuvenation. Remember that we have also the Morpheus A, the EMS. We have multiple machines that they can help you to achieve that look that you've been
timeless.
Look.
Yeah.
Yes.
Right?
But
I know. I think I get questions all the time about Botox filler, and so does he. And really, I think a lot of people, Doctor, can you explain what is the difference between Botox and filler?
Okay. But just to start to talk about Botox and fillers, and there is a huge difference between Botox and fillers. Botox, and I have one of my patients or one of my friends that actually she asked me, I don't want to use the Botox because it's a toxin.
Mm-hmm.
And number one, Botox, more than a toxin, is like a kind of enzyme.
Enzymes?
Yeah, it's like a kind of enzyme. But it's called a toxin because Botox is secreted by the bacteria. A bacteria as a mechanism of action of the bacteria. How this bacteria affect the body is releasing the strain of the muscle. That means making the muscle less strained, less stronger.
Kind of
relax the muscle. Exactly.
Okay.
So this bacteria,
so the muscle cannot.
This bacteria is called the botulism. Mm-hmm. So this bacteria release. I mean, when you are infected by this bacteria, it's the whole body. It's an infection. Imagine that you have a pneumonia, or you got a flu, or you got a COVID. You feel the entire body. So this bacteria start to release all of these botulinum enzymes that they cause the kinds of relaxation of the muscle. It can relax the muscle of the respiratory of the chest. That means that you're gonna have problem to breathe.
Wait, hold on. Are you telling people they can get Botox in their chest?
No.
I know.
No, I'm talking about what the
people I
no.
know.
I'm talking about the story. Where it's coming.
Yeah.
So before, people that were thinking it's a toxin, is something. Yes, it's something that comes from a bacteria, but it's a very small amount. If that toxin gonna go to my brain, of course no, doesn't go to your brain. It's very, very controlled dosage of this kind of enzyme that relax the muscle. And the difference between Botox and filler is that the Botox, what it does, relax the muscle, and relaxing the muscle underneath the skin also relax the skin on top. Because if the muscle, imagine that these are the fibers of the muscle. If the muscle is contract, the skin that is on top is also contracted and create the wrinkles. Mm-hmm. But if the muscle relax, the skin that is on top is also smooth and relaxed.
Okay.
But the other question was about the filler.
Right. So, yeah, a lot of people don't understand the difference. Like, what is filler compared to Botox? Some people are, they come and they're like, I think I need Botox. I think I need filler, but they don't really have a clue.
Okay. Fillers. The fillers actually, they start to get popular back in the 80s. Mm-hmm. And the reason why is actually was research of first use approved by the insurance for the HIV patient. HIV patient, most of them, they get the treatment that is the triple antiviral anti-HIV medication. And one of the side effects that this medication they have is that they lose the fat part of the sheep. Mm-hmm. So most of the people they have HIV, they lose sick, even though that the disease is under control, because they lose all the fat of the sheep, the volume. So the fillers, they start to be used for this population just to reintegrate that fat tissue that they have lost.
Mm.
And that is how it starts. That is a story of how the fillers are in a different from Botox. The fillers are hyaluronic acid. That is part. Is a substance that our body produces. Hyaluronic acid. This hyaluronic acid is injected in the subcutaneous tissue in the areas that the fat pads in our face. And I think that we have a book around there that we can bring it later, that you can see what are the fat pads in our face and how we can regenerate that, substituted by hyaluronic acid, and give the volume and give the appearance of youth. As a difference of the Botox, that just relax the muscle, the fillers, what they do is just recreate the volume that you have lost.
For instance, like my lips.
Uh-huh.
That's volume added.
Yeah.
Not paralyze or the muscle.
Yeah, not relaxing the muscle. Yeah. So the fillers, we can do the fillers in the cheeks, in the lips. There are some kind of wrinkles sometimes that they are very deep that we can put a little bit of filler. And lately, it's been a lot of doctors that they've been doing they call the non-surgical rhinoplasty. That means that with fillers, they're gonna do, make your nose a little bit narrow. If you have any kind of septum deviation with filler, they can fix it. And the good thing is, like, it's not permanent. If you don't like it, if you get too much volume, and it will go away after a year. And it gradually goes down, but after a year, pretty much your body reabsorbs the hyaluronic acid and disappear.
So what about Botox? How often do you typically have to get Botox?
Okay.
And at what age? Some people say, "Oh, you're too young, or you're too old, or you whatever." What's the ages?
Okay. So Botox, as we were talking before, is the one that relaxes the muscle. Actually, Botox you can use it as a preventive, and I have seen patients in the 20s that they've been getting Botox. There is something wrong with that? Of course not. There is nothing wrong, because you're not doing anything just to prevent those areas of the face that you have a lot of facial expression, to create those wrinkles, those lines that later on you're gonna pay for. So younger that you start, better that's gonna be the result. And there is nothing toxic, nothing
So,
bad.
for example, kind of like, the crow's feet that people see. So the Botox injected, it makes it so you can't really you don't get those lines. That's why it's preventative.
Oh yeah, definitely,
right?
Definitely for the crow's feet.
Or like the angry 11s.
The 11.
You're not doing that with your muscles. So
the glabella area.
11s are not
Exactly.
getting deep.
Exactly. I mean, what you.
But if you're somebody that has been doing that, like the angry 11s, and getting the deep lines for maybe 50 years, and you have a deep line, then you do Botox to relax it.
Yeah, you do the Botox to relax it. But what's gonna happen is, like, what is the difference? A person that is in the early 30s and has a wrinkle in her face, or have the crow's feet, or the glabella area, or whatever, and you want to inject the Botox, that person, those wrinkles, they've been there for a shorter period of time. So that means that the amount of medication that they're gonna use and the treatment that they're gonna need gonna be less than a person that he's
right.
or she is 50, 60 years old, that those wrinkles, they're already very deep. And actually, I compare the wrinkles like scars. If you look at, there are some people that they have wrinkles in the middle of the face that they look like they went for surgery a long time ago, and they have like a scar. So one time that scar is in place, is very, very hard to remove. And sometimes you don't have any more option than just going for surgery, because they are so deep that they have to get in the subcutaneous tissue and do all what is necessary to remove that scar.
What are any complications if people are asking for Botox or filler, or side effects, or?
Well, the major complication for Botox. Let's start first with the Botox.
Okay.
The major complication for the Botox is that you inject the Botox. That is why you have to look at for a professional and someone that really have the license and the training to do the Botox, because number one, there are some vascular vessels that they are in the face. Number two, if you inject the Botox in the wrong area, you get a droopy eye, because I already went to the muscle that actually is responsible to keep my eyes open. And if I inject over there, I'm going to have a droopy eye or droopy eyebrow. So the location, it has to be very precise where you inject the Botox. You have to know where you inject it. Otherwise, you're going to have those kind of complications. And the patient going to go back to you like, doctor, look at my eyes. Look at what you did. I came for the wrinkle. I have now one eye closer than other, or
So
one
what
eyebrow.
happens if that happens?
There is nothing to do.
I mean,
You
I'm
have
just
to
saying,
wait.
if someone's watching this that has never had it and they,
You have to just
What-
I'm sorry, you have to wait.
so
You
it's
have
just
to
wait
wait.
it out
You
until
just wait
wears
it
off.
out,
There's nothing you can do.
There is nothing
But
that
the
you
good
can
thing
do.
is that it's temporary.
Yeah, it's temporary. It's
Temporary.
actually most of the patient in 1 or 2 weeks they start to see the improvement of that lesion. But definitely, my first recommendation is don't go. And especially in our Latino population, it's very common that they go to the lady that come from Tijuana with the little secret bottle and do the injection and stuff like that because it's cheaper. It doesn't cost me anything. Careful with that.
Okay, can you do Botox anywhere else in the body other than your face?
Actually, you can do Botox in the neck, and also Botox is used as a medical medical treatment for migraine headache. Also for there is a condition that is called stenosis of the pyloric stenosis, where they inject the Botox. Is part of our digestive system, and to relax the pyloric also they can do the Botox.
What's that?
It's just part of our digestive system that let the food coming into the stomach.
I haven't heard that one.
Yeah. Okay. But yes, it happens.
Wow.
Yeah.
And I've heard of like sweaty armpits and things.
Yes, you can do. You
People
can do.
Yeah.
You can do for the sweat glands underneath the arm. Also, that can help. Also for the hands, if you have sweaty hands, also you can do Botox there. Also, that can help. Yeah.
Cool. And then for filler, anything you would say? I mean, fillers. Yeah. Fillers, actually, we have to be a little more cautious because definitely there are a lot of vessel, arteries, veins, and nerves, and different structures that they are in the face that they can be affected by the filler. As a different of the Botox, the fillers can cause occlusion of an artery. That means that I can inject the filler and the filler can go inside my artery and blocking the circulation of the entire area. I mean, especially over here in the nasolabial area, there are many complications because they are very superficial vessels that sometimes, even though that you are the most expertise treatment, specialized in aesthetic treatment, you can have those complications. They are very mild complications. It can be reversed by hyaluronidase. That is actually a different kind of medication that we immediately inject to resolve that kind of occlusion of the artery. interesting.
But the other part is like, the misconcept, what everybody think about when you talk about fillers. The Gucci lips.
Yeah.
Yeah. So there are people
Lips.
that they think like fillers, they have to be necessary like that, like a big lip, big cheek, and people that get, when they call, hi doctor, I don't want to look like those Orange County wife or something like that. I mean, No, not necessarily have to happen like that. It can be very mild. It's because everything depends of the volume that how many vials, how many injections we are given. And that is what it actually changed the structure of the face and made the people look like a different because it's too much volume. But if you just restore the volume compared when you were like in your 40s, you're gonna look good. And the best result is when people they look at you and they say, "I know that you got something done, but I don't know what it is." So that means that treatment that was right.
No.
Yeah.
Amazing. Well, I obviously, I just was asking the questions that I get and I don't know all the answers, but thank you for sharing that.
Yeah,
I know.
yeah.
I mean, it is a preventative thing. I've been
preventative.
dabbling in it and
Yeah.
I love it.
No, it's preventative. Yeah. You look great. You look great. You look great. But I mean, beside that, it's important in prevention for aesthetic medicine, for general medicine, for any condition, the good nutrition, the hydration,
role, yeah.
to avoid the sun exposure. And we have some blocker that we have here that we sell it here in our clinic, so you can call us. The telephone number is over here. But you have to protect your skin, and you have to do one other thing. I was against of that. Number one, nutrition, protein supplement. I was like, no, I will not do that. I definitely I can see it not only in my body, I can see it in my face. I think so.
No, it makes a big difference.
I think so.
Look, collagen and protein, having the supplementation, it definitely makes a difference. Yeah. You know what I have to say about that.
And I have to say thank you, Robin, for my protein supplement. And
all
the supplements.
You know what? Can we talk about that a little bit? Because I think a lot of people are looking for protein added into their diet on a daily, but it's quality, looking for quality ingredients and things that don't have sucralose, don't have aspartame and artificial chemicals that you're putting in your body that's just wreaking havoc on your aging, doing a cellular cleanse here and there a little bit. But the collagen,
what is
the collagen, our body, I know this, tell me if I'm wrong, doctor, but as we, no, but literally, our body is made up of like 80% collagen protein. And as we age, we start to lose it.
Yeah.
Like our hair gets thinner, our face gets saggier, more wrinkles, the joints, everything is cracklier. So we need collagen.
That
you're absorbing though.
Definitely.
A lot of people are taking a powder that's getting oxidized. And so the Isogenics collagen elixir that we have here is really quality superior that you're absorbing.
No, I'm taking the collagen, the hair growth pillow.
I know, it works.
They hydrate, the protein, so everything to
hold on. And you literally were like,
NAD.
I don't need extra protein powder.
I know. I did.
And then you just gradually start to, okay.
I have to say it.
Wwhy did you start taking it?
That is another episode.
You tried, but you were like, okay, I'm just going to start it.
I know. But
now I am not pushing your button, whatever, but you're like, no, this protein, this stuff works.
One other thing is like, I mean, I actually, before that I was taking my protein, I was in the middle of the day, I was super hungry, eating whatever I want. And pretty much most of the time, those were the bad options. So I get a piece of cake, bread, coffee, sugar, and I haven't done that anymore. Honestly, I haven't. And look at you. When I want to.
Look at you.
Should I show you?
No, but seriously.
No, yeah. No.
It all matters.
My body has suffered a transformation after I started the protein shake, the hydrate, and all the products. So you can call us. The telephone number is over here. You know the telephone number?
714-602-9670.
Call Robin. Call Robin.
Yes, we will get you set up. on the right path, holistic health from the inside out. Like I can do, the Botox, the filler, absolutely. But if I didn't supplement from the inside as well, it would not be the same effect. Like, why would I go down the street and keep pouring junk and chemicals in my body? So,
exactly. No. We are pro good health, good nutrition, but why not to look good too?
Yeah.
Oxide inside. Oxide inside. And this is part of medicine. And most one of the things, Robin, is like more and more of the primary care physician that are getting in aesthetic medicine, rejuvenation and stuff like that. Because, it's a safe way.
A lot of people, everyone wants to feel better. They want to look better. And sometimes, aesthetics matter, but who you are inside. And there's even a lot of people that go through different medical situations in their health. We don't have to talk about it, but, a woman going through breast cancer and things, and she just wants her face to look better for herself.
Yeah.
And so that was just one situation.
I have patients that they have pretty bad breast cancer. They went through chemo, radiation, so and so, and they want to look better, and they come for Botox and fillers, and they're cancer survivor. They want to continue their life. Why not? Why not?
Absolutely.
So, and this for aesthetic medicine is long time ago was more like a taboo.
Yeah.
Like, oh my God, I'm using Botox. I'm doing fillers. Oh, it's a secret. Nobody should know.
Yeah.
But right now, it's pretty open.
Well, honestly, I feel like this is the first time I'm talking about it, and I have been.
Yeah.
And I'll talk more. I'm more freely talking about it. I don't
Yeah,
care.
why not?
And to my friends and family, I would talk about it.
Yeah, why not? But you look great.
Yeah, thank you. No, but it's preventative. All the things that we talked about. If you guys have questions, just reach out. Also, we do have payment plans for people that are looking at that and getting
payment plan. That means that you don't have to pay up front.
Right.
Yeah.
So you can give us a call.
Call Robin.
Yeah.
the telephone gonna be ringing. Calling Robin for protein shakes, supplements,
and fun. No, but seriously. If you have other questions about Botox, filler, consultation, we would love to meet you. Help you reach
definitely
whatever visions and desires that you want.
Telephone number one more time.
714-602-9670.
Orion Med Spa.
Yes.
Okay.
And you can go to oreemmedspa.com and check out all the other things that we have.
Yeah. How do you spell Oreem?
OREAM.
Okay.
Like dream, but dream, but Oreem Med Spa.
Where the name came
Where did it come from?
I will tell you later, another day. Yeah.
Another day.
Why not?
Okay.
And remember that we have an event November 17th.
November 17th.
Save the date.
Save the date.
November 17th. Noviembre 17. Un gran evento. Así que esténse atentos. Yeah, I say it in Spanish for my people.
I'm learning Spanish.
Okay.
Let's go.
Okay.
Muy poquito español.
Muy poquito.
Muy grande. It's coming.
What?
How do you say it? I don't know. Large.
Muy
No,
grande.
What do you
That
say?
is inappropriate. Muy grande is coming. That is inappropriate comment. Okay, I will not tell you. Okay. Bye. Robin is getting another topic, totally different from Botox. Different from Botox and filler. Okay. Okay, bye. Cut. Okay, vamos, se acabó.